Ellen Allen. So you're just outside of Charleston, West Virginia.
Yes.
Tell me about the health care plan you are currently on.
Hi, Katie. Yes, thanks for having me. I am on a bronze plan, and I currently pay, as you said, just under $500 a month. It also includes vision and dental care. It's a bronze plan. You know, it has higher amount of coinsurance, but I've been happy with it. The same plan without vision and dental, because it went up so much, will cost me almost $2,000 next year. And that's about 320% increase. And then you calculate an additional maximum out of pocket and coinsurance, you're pushing over 400% increase. So, and I'm not the only West Virginians that are looking at exorbitant increases in the coming year.
What are you going to do?
Well, I've been planning for this. We do this work all the time. So that's what we've been working and educating West Virginians about the entire year. So I've set up my own health savings account just to squirrel away some money so I can do that. I'm 64 years old. I don't want to go without health insurance, obviously. So I'm just going to have to foot that bill. You know, I'm fortunate in that our organization helps pay a stipend to our small staff, but still it can't absorb all of those costs. So it falls on the individual, as it will over 67,000 other West Virginians in the state.
Congress yesterday voted on two bills. One of them was an extension of the ACA subsidies for 3 more years. That was a Democrat-backed bill. The Republicans voted on a bill to deposit money directly into health savings accounts, I guess like you've opened up for yourself. For you, because you're over 50 years old, it would be $1,500 directly into that account. Wouldn't be able to use it to pay for your premiums, but any other health care expense. Did you have a preference for one of those plans?
Yes, I would like to see the 3-year extension. And in that time, hopefully our lawmakers could get in a room and do some real work on addressing the affordability of health care. You know, look at site neutral payments, look at what's driving the increase in healthcare costs, which is really hospital costs. I look at price transparency. So that's what we prefer. And, you know, I think the HSAs, I think that's illustrative of just how out of touch our lawmakers are. Not only could that $1,500 one-time payment, that's not even per month, it's a one-time deposit into an HSA, and there are some tax benefits, but, you know, when people's health insurance premium is $2,000 a month and upwards, and again, the maximum out of pocket pushing $10,000, you know, it's almost laughable. Again, that shows how out of touch they are. You have to have a high amount of disposable income for the HSAs to really benefit your household.
The Republicans say the ACA is terrible. They have real problems with it. They've not liked it since the beginning. They say it's really vulnerable to fraud and that it doesn't work. What's your experience with the ACA been?
Well, you know, they've had 15 years to fix it, and they've come up with nothing better. I think, frankly, it's an extraordinary achievement that has reduced the uninsured rate around the country. Could it be better? Of course. Addressing the costs of hospital costs, again, site neutral payments being a big issue, that's something lawmakers should get together on and address. In West Virginia, prior to the ACA and Medicaid expansion that came about at the same time, West Virginia had close to a 20% uninsured rate. Since the ACA came into law, that rate is below 6%. Now, that's an extraordinary achievement. And many people in the industry think when you get around 5%, you're really speaking of functionally practical full insured rate, because there's always going to be some people that, for whatever reason, don't want to be insured. But the insurance is very good, and it truly does give affordability and access to every single American.
What are the folks you work with going to do?
Well, I know one person who is not going to have health care coverage. She just can't afford it. We've been going around the state in our Cuts and Consequences tour, and people ask us, what do they do if they know they can't enroll because of the high premium costs? You know, they're going to FQHCs, free and charitable clinics, and you know, West Virginia has a really good network of free and charitable clinics and FQHCs. But you know, if you have a catastrophic event, a chronic illness like cancer, you're in a car accident, you're hospitalized, that's where you have to depend on your health care coverage.
Ellen Allen, it's really good to have you. Thank you so much for saying yes to the interview. We appreciate your time.
Absolutely. It's been a pleasure to be here.
Good luck with
Thank
those
you so much.
bills. You're a year away. You're a year away from Medicare.